Cervical cancer is the fourth most common cancer among women globally. In low and middle income countries, it is the second most common cancer, and in some countries of the world, like in sub-Saharan Africa, it is the most common cancer among women. 85% of new cases and 88% of deaths from cervical cancer occur in low and middle income countries. The majority of these countries do not have cervical screening programs and will be unable to implement these programs in the short term. Deaths from cervical cancer, which affect 260,000 women each year, is a preventable tragedy for these women and their families. HPV vaccination is an option to consider for these women. Since the year 2003, many countries have implemented national immunization programs against HPV diseases. In some of these countries, assistance has been obtained from Gavi as well as the Vaccine Alliance. The implementation of national HPV vaccination programs in two countries will be discussed. Malaysia, the country that I come from, introduced a national HPV vaccination program in September 2010. Malaysia, at the time of implementation of the national vaccination program, had cervical cancer as the second most common cancer among women. This was largely because of the low uptake of cervical cancer screening. One of our national health and morbidity surveys carried out in the year 2006 showed only 43% of women went and availed themselves to cervical cancer screening. With the introduction of the national vaccination program, we had very high coverage rates of 97% in schools. The reasons for the success of the program was professional endorsement and recommendation, political will and leadership, involvement of all stakeholders early, and having a mechanism to predict and manage problems as they arose. In Bhutan, cancer of the cervix was the most common female cancer. The incidence was 32% of all female cancers in the age 23 to 65 years old. This country too successfully implemented a school-based national HPV vaccination program that has coverage of about 100%. 1 year after implementation of the school-based program, the authorities decided to change to a clinic-based immunization program, and immunization rates dropped to about 60%. Realizing their folly, the country moved back to a school-based program and vaccination rates were high again. There are large global disparities in health, and much needs to be done to improve cancer control in countries with a high incidence of disease and limited potential for screening. Unfortunately, of the 118 million women who have been targeted globally by HPV vaccination programs since their introduction in 2006, only about 1% come from low and middle income countries. Therefore, much needs to be done by us to increase the availability of vaccines for these populations. Vaccines need to be made more available and more affordable, and we also need to battle the misconceptions regarding safety that some people have regarding these vaccines.